very good morning, students. This is a brief note about the nasal septum. Okay, the nasal septum is a midline structure between the right and left nostrils. Okay, so we will learn about it in brief. Okay, the nasal cavity between the anterior nostrils, okay, which we see on face, okay, and to that of the posterior nostril, which is in the nasopharynx, facing towards nasopharynx, deep inside the pharynx. Okay, so the nasal cavity between anterior nostril to the posterior nostril is divided into two halves, okay, by a septum. There is a midline septum which will divide the nasal cavity into two halves, okay. This septum is present in the midline and is known as nasal septum. Okay, so septum is in midline and it is called as nasal septum. Okay, the description of the medial nasal septum is as under. Okay, I will just describe the medial nasal septum. It is partly bony and partly cartilaginous in nature. That means the medial nasal septum is formed by bone as well as by cartilage. Let us see here in this diagram. I had drawn for the median nasal septum. Now just to get an orientation, this is a midline section which is showing the median nasal septum. This is the frontal bone, frontal air sinus, the nasal bone, okay. This is the ethmoid bone, okay, crista galli, and on that will be the ethmoid bone. This is the sphenoid bone, sphenoidal air sinus, and this is sella turcica, pituitary fossa is here. This is the incisor teeth which is cut in midline, just paramedian, you may imagine. And this is the maxillary bone, the hard palate, okay, the hard palate of the, this is the perpendicular plate of the palatine bone, okay, horizontal plate, okay, this is cut transversely, okay, horizontal plate of the palatine bone, cutting in the mid-sagittal section. Now, these are the structures which forms the median nasal septum. Now, as we know that this is partly bony and partly it is cartilaginous. On the upper part, it is formed by the perpendicular plate of the palatine bone, okay, the perpendicular plate of the bones, okay, and the ethmoid bone and the vomer bone, okay, ethmoid, and this is the vomer bone. Lower down it is, this is above is, as I said, is ethmoid. So it is the perpendicular plate of ethmoid, okay, and then it is vomer. So this part, this was ethmoid, and this is the process of the ethmoid, that is called as perpendicular plate of ethmoid, okay. So this perpendicular plate and posto-inferiorly the vomer bone, these are the two bony structure which forms the median nasal septum, okay, the median. Now in between there exists a gap between the inferior margin of perpendicular plate of ethmoid and anterior margin of the vomer bone. This triangular gap is there, and this triangular gap is filled by the cartilage, okay. So the cartilage is called as the septal cartilage. It is hyaline cartilage, okay. It is septal cartilage. It occupies thus the space between the two plates, ethmoidal perpendicular plate and the vomer bone, okay, and the vomer bone anteriorly. Okay, there may be a small septal bone also here, which is a part of the nasal cartilage. So this is septal, lowermost septal process of the nasal cartilage. So these are the cartilaginous bone which are filling the gap between the perpendicular plate of ethmoid and vomer, and they lie anteriorly. Thus these bones and cartilage which forms this nasal septum, the bones and cartilage are covered by the fibro-fatty tissue and mucous membrane, okay. So in living condition there is a fibro-fatty tissue immediate in relation to this bone and cartilage, and the whole area is then covered by the mucous membrane. Okay, so the mucosa of the upper part of the nasal septum is olfactory in nature. When we will see the mucosa, this is the bony structure. Let me show you the thin mucosa which is covering to this. Now this I am using again the theme dissector, and I am the author for this head and neck and brain volume. Okay, and I am using this diagram just to show you, and for that I am thankful to the theme. This is the median sagittal section of the head. Okay, and you can see for orientation, this is the nose, these are the lips, and here tongue, this is the maxilla, hard palate. Okay, and this is the palatine bone. Okay, now, between this ethmoid bone here, cribriform plate and crista galli of ethmoid, which is facing towards the anterior cranial cavity, this bone or the process of the bone here, from here to here, this, okay, deep to the mucous membrane it is seen. It is the perpendicular plate of the ethmoid, okay, perpendicular plate of the ethmoid, and this is the vomer bone. This part is the bone, and this is that septal cartilage. And these two structure, bony and cartilaginous, they are covered by the thin mucous membrane which is looking pink, and through which we are seeing these bones. Okay, so it is covered by the mucous membrane on either side, that is on right side as well as on left side of the median nasal septum. So this is how the median nasal septum is there, just postero-inferior to this median nasal septum, which is facing here, this midline facing towards the nasopharynx. This is the soft palate, and this is the hard palate, and soft palate is also covered by the mucous membrane. Okay, let's come to the after learning this description of the bony and cartilaginous plate and how it is covered by the mucous membrane. So it is a thin septum. Let's go to the nerve supply of the septum. Now for the nerve supply, I have drawn this rough diagram where you can divide the median nasal septum into two parts, okay, anterosuperior and posto-inferior, by an oblique line passing above the lip, okay, above the lip. So this is an anterosuperior part, okay, of the septum, is innervated by an anterior ethmoidal nerve. This is anterior ethmoidal nerve, while posterior part by the nasopalatine nerve, which comes from the pterygopalatine, ganglion. Okay, so this is the nasopalatine nerve is there. So there are two nerves, that is anterior ethmoidal and the nasopalatine nerves are there, which are branches from the pterygopalatine ganglion. Now there is the third kind of the nerve is there, which is called as olfactory nerve, which is present in the superior part of this median nasal septal mucosa, and this olfactory nerve carries the spatial sense, okay, for smell, while this anterior ethmoidal and the nasopalatine nerve, which are branches from ultimately trigeminal nerve, okay, that is ophthalmic and maxillary. Okay, this will supply the general sensation, that is pain, touch and temperature. Okay, so sense of smell by olfactory nerve and the general sensation from the branches of the trigeminal nerve, anterior ethmoidal and nasopalatine part of the nerve. Okay, now let us come to the blood supply of this median nasal septum. Now the blood supply of the median nasal septum is for that again you divide into the anterosuperior and posto-inferior part by this oblique line of the median nasal septum, and this anterior part is supplied by that of the anterior ethmoidal artery, anterior ethmoidal from the ophthalmic artery, okay, anterior ethmoidal artery. According to some authors, some of the branches from posterior ethmoidal may come also in the the upper part, but according to most of the author, it is only supplied by the anterior ethmoidal artery. Then the posterior part is supplied by the sphenopalatine artery. Okay, the posterior part is sphenoethmoidal artery, and then a part close to that of the upper lip, it is by the superior labial branch of the facial artery, will also go and supply the anteroinferior part of the nasal septum, anteroinferior, by the facial artery. Superior labial branch of the facial artery will also supply. Now here I have drawn a smaller area on the median nasal septum, anteroinferior part, and here there is a plexus is shown here, which is formed by the branches of anterior ethmoidal, facial artery branches, and sphenopalatine branch may also come here to form a arterial plexus just beneath the mucosa. Okay, I mean, say within the mucous membrane, you may say that. And here the venous plexus is also there. That's why I have shown you the few blue lines. So this plexus is called as Castle-Back's plexus. It is called as Castle-Back's plexus, and this is the common site for the epistaxis, which is the meaning of which is that the nasal bleeding, which usually occurs during summer and usually in the small, I mean say children. Okay, so this is that Castle-Back, which is nothing but the plexus of the artery. Okay, that I can show you from this dissector again. Okay, here you can see this. This is the branches where he thinks that posterior ethmoidal also supply the nasal septum. Okay, let me show you properly. Okay, I hope you can see it here. This is the sphenopalatine artery, anterior and posterior ethmoidal. The facial artery he has not shown, but the superior labial branch of facial artery will also come here. And this is that plexus, which will be the arterial plexus in the in the mucosa covering to that cartilaginous part. Okay. So this is the common site for that of the bleeding in the septum, okay, from the septum, right? Let us come to the venous drainage, okay, though I have not drawn the diagram, but these are corresponding veins. It will be the ophthalmic vein, the blood will go to the ophthalmic vein, it will go to the pterygoid venous plexus, which is just lateral to the lateral pterygoid plate in the infratemporal fossa. Then this may also go, okay, to the inferior cerebral vein, and naturally it will also go to that of the facial vein. Okay, so the communication of facial vein with that of the pterygoid venous plexus we have already learned, which goes and drain ultimately into the cavernous sinus, and thus the upper lip are considered as the part of the dangerous area. Okay, dangerous area. The lower nose and the upper lip, they are called as them because of this anastomosis between the pterygoid venous plexus and that of the cavernous sinus. So this is the venous drainage from the median nasal septum. Let's come to the lymphatic drainage, and the lymphatic drainage from anterior half of the septum. You can see the anterior half of the septum goes to the submandibular group of lymph node. Okay, so anterior half of the median nasal septum will drain to submandibular, and the posterior half will drain to the deep cervical group of lymph nodes, to the deep. So a submandibular and deep cervical group of the lymph node. Lastly, of this note, we come to the applied importance. The applied importance is in relation to that of the, again, the same plexus, okay, arterial and venous plexus, which lies just adjacent to the, in the mucosa, adjacent to the septal cartilage in anteroinferior part. And this area of the plexus is called as the little area, okay, this known as the little area. And this forms a plexus which I have already described as Castle-Back's area and our plexus, and it is a rich in the vascular anastomosis between septal branches of greater palatine, sphenopalatine, anterior ethmoidal and superior labial branch of facial. Okay, so many arteries, they come and form a plexus, and this may lead to enduring mostly during summer season into the epistaxis, which is the bleeding from the nose. Okay, so this is the first applied importance in relation to the median nasal septum. The second applied importance in relation to the median nasal septum is that mostly it is not in midline, that is septum position in most of the people it is not exactly in the median plane, okay, or in midline, but mostly it is deviated either to the right side or to the left side. Okay, so this is called as deviated septum. This is called as deviated, so which otherwise should have divided the nasal cavity into right and left equal half is not. It is deviated to one side. Okay, and if it is deviated to right side or to the left side, that half of the nasal cavity, okay, portion may become narrow. Okay, become narrow. Okay, and this may produce the obstruction in breathing, especially during the infections of the nose, like the common cold. We must have experienced during the common cold, one of the nostrils, okay, through which you are breathing is usually closed. Okay, usually that means it is narrow, it becomes narrow. Okay, and breathing through which is obstructed. So this complete a short note on to the median nasal septum, okay, which may be asked during the examination as the short note. Thank you very much for watching this short video.